You are listening to CEO Perspectives, a podcast by the Conference Board.
Welcome to this episode of CEO Perspectives, a signature webcast and podcast series by the Conference Board. CEO Perspectives are conversations that take an objective, nonpartisan look at a range of timely topics that matter most to business leaders. To help make sense of these topics and how they'll unfold, we'll sit down with thought leaders and do what we do best at the Conference Board, provide trusted insights for what's ahead. I'm Steve Odland, the CEO of the Conference Board and the host of this series, and today's conversation will focus on the U.S. healthcare system. What's the current state of our healthcare system? What's working? What isn't working? How can we lower costs and improve outcomes? And I'm so pleased today to have joining me George Barrett, the former chairman and CEO of Cardinal Health. George was at Cardinal in that role from 2009 to 2017. George is also a trustee of the Conference Board. And additionally, George is the founder of the Overtone Group. George, welcome.
Thanks, Steve. Good to be here.
George, Cardinal Health is a global company. It was the 14th largest company in the nation, $162 billion in revenue, distribute pharmaceuticals, medical products, hospitals, and so forth. I mean, this is one of the biggest and greatest companies in the world. Talk about your background, though, in healthcare.
Glad to. So it's been a long, nearly 4-decade journey. I will say it started out in a perhaps less conventional way. Steve, I think you know my undergraduate degrees were in history and in music. And I left college and headed off to New York City to be a professional singer. And along the way, made an unexpected detour into healthcare. And that's about 1981. I had an opportunity through a family relationship to join a very early stage company that was doing basically production of dermatologicals, both as a contract manufacturer for large pharma companies and really for generic products. And so it was a great experience. You know, I stepped into it relatively clueless. So in some ways, it's the perfect opportunity because you don't know much and you're learning from everybody. And along the way, some important things happened. The Hatch-Waxman Act, or the Waxman-Hatch Act, occurred in 1984, which sort of essentially created the modern generic drug industry. I had an opportunity to work in sort of every part of the business, got an MBA along the way, and about 10 years later, we were acquired by a publicly traded company that was headquartered in Norway called AL Laboratories, which became Alpharma. I wound up staying with them a year after the acquisition. I was asked if I would consider running their largest U.S. operation, their flagship operation, which was the largest producer of liquid pharmaceuticals in the world. And so off I went to Baltimore, Maryland. It was an amazing experience. First time in a publicly traded company. You know, I was in my mid-30s. I was leading a management team of folks mostly in their 50s who were, I think, completely perplexed that I was there at first. But it was a reminder that it was a great opportunity not just to learn from your authority figures, but from people who actually work for you, who really taught me so much. I spent almost a decade there, and then in late 1998 joined Teva Pharmaceuticals, first as the president of the U.S. business. Eventually head of their North American businesses, and just an incredible time. Teva was at the time not only the largest generic drug producer in the world, but by volume probably the largest producer of pharmaceuticals in the world, both in generics but also in specialty pharmaceuticals. You know, a very global company. I got to experience cultures all over the world. It was a really extraordinary and wonderful experience. And then in 2008. Had the opportunity to join Cardinal Health. And, you know, Cardinal at the time, I was really drawn to the range of activity that it was involved with, just so many different business areas, but also its footprint and its touch points across the systems, basically touching everybody from pharmaceutical manufacturers to med tech companies, to hospitals, to pharmacies, to our fleet and the VA. So it was a really extraordinary experience. I loved my time there, and it's been a wild 40 years.
Yeah, and now you're doing leadership things. So you're really an inspiring career and just incredible experience. You know, the U.S. healthcare system has gone through a transformation. I think maybe you disagree, but the ACA, of course, was enacted in 2010, which changed our system in order to try to increase quality, try to increase access, try to increase and lower costs. I think those were the original goals. As you look back now, a little over a decade later, how do you grade this? Have we achieved the goals that were established with ACA, and if not, where's it fallen short?
Right. Yeah. Well, I think you're right on the mark in terms of the intent of the Affordable Care Act. It was really about coverage, access to care, and it was about cost/affordability. And it tried to deal with some very specific issues like pre-existing, pre-existing conditions and portability. I think the answer probably from any of us would be mixed results on some level. We certainly have reduced the number of uninsured and underinsured, probably by somewhere between, depending on who counts it, 11 and 15 million Americans, which is not trivial. We certainly expanded coverage for pre-existing conditions, which again made healthcare more portable. Didn't tie people necessarily to their jobs in order to retain their healthcare. And I guess you could argue that we were able to stabilize healthcare costs as a percentage of our GDP, but we didn't reduce it. I think there are. I'm going to add one other piece. I do think that there were some efforts to start to tinker with the business model of healthcare and to try to look at alternative models of care, largely done through what was called CMMI, the Medicare Innovation Group. And there was a lot of experimentation with value-based models rather than sort of a fee-for-service model, which we'll probably come back to. So those were sort of the positives. I think the challenges, as I said, only somewhat partially successful in terms of coverage, partially successful in terms of cost. We certainly would have to acknowledge that there are things around it that made it much more difficult for it to succeed. In its design, there were some things that made a lot of sense. And in fact, as many know, this was really not the byproduct of sort of a quote socialist agenda, but really in many ways built around sort of a center left, center right model of care. The challenges were significant. When we started to tinker with the mandates that essentially defanged part of the system, when states were not willing to expand Medicaid, we saw another sort of chink in the armor. And so maybe there were some also design flaws, making it less attractive, for example, to have young, healthy people in the system, which we desperately need in the system, essentially to smooth the pool. So, and then of course, the politics of everything these days is sort of extraordinary. And so in a sense, when you start to cherry pick pieces of a very technical piece of legislation, the likelihood that you're going to get exactly what you designed is diminished. And I think, again, not to blame anybody or to defend anybody, but it's sort of just factual that we wound up cherry picking pieces of this legislation, and so the results as a result reflected that.
Yeah, and ACA, it's PPACA, but it's nicknamed Obamacare.
Yep.
After President Obama, and I talked to President Obama about it, and he acknowledged to me and a group of CEOs at the time that a lot more work was needed. This wasn't the end. There was, that this was the beginning, and it wasn't perfect, and so forth. And I don't think that anyone thought that this was perfect, and that that there wasn't more work to be done. So I think that completely echoes some of the things that you said. So one of the things that, if you look at the U.S. versus other countries, and we'll come to other countries later, but why is healthcare so expensive? I mean, healthcare in total, you've got pharma, you've got hospitals, treatments, and you've got insurance, but it's roughly 20% of our GDP. I mean, why does it consume so much?
I'll do the best I can in answering this. It's a complicated story, as you well know. It's let's start with the basics. It's a disjointed, very fragmented system in which there's very poor, at best, very poor alignment between the user of the good or service, the payer of the good or service, and the decision maker, of the good and service. So if you think about when we buy a car, presumably we're using it for our own or our family's use, us, we are paying for it, and we're the decision maker. And when those things are aligned, it's a lot easier to sort of get the outcome that you want. But when they're completely disconnected, that is a huge challenge. And in some ways, again, in its design, a lot of experimentation has been done to try to sort of deal with that misalignment. And it's created also this system, this what we call fee for service system, which is basically we pay for activity. And so at its very nature, that is a perverse incentive. It incentivizes doing more stuff. And so the fundamental design is flawed. And I think you probably also know that there are some really disproportionate parts of our spend. So chronic illness is a huge issue for us in this country. It is around the world, but it is a huge issue here. It's probably 60% of our spend. Ironically, end of life care is 10% of our spend. So we have some behavioral health has a huge influence on our spend. We know that's a comorbidity along with many chronic conditions. And so I think it's partly the disjointedness. It's partly this basic design of fee for service, which is incentivizing activity. And that's why you're seeing experimentation with what we call value-based models. How do we essentially pay for the outcomes of care and good health versus paying for the activity around sickness? If that makes sense?
Yeah, I mean, you're using the term fee for service. Essentially, we pay doctors for doing tests. You know, every test, every little procedure gets an incremental fee, and that's how they make more money. Not only doctors, but the hospitals and so forth. So what you're saying is, don't incent more cost that may be wasted or unnecessary. Incent payment by outcome, which is taking care of people and making sure they get well. Is that a fair summary?
Exactly. Now that is easy for me to say and extremely hard to do. So let me give you an example of places where it's easier. Hip replacement, okay? We know what to measure to determine whether a hip replacement has been done effectively. And so for that reason, we've seen more what were called bundles, sort of capitated programs to say, we will pay this much for a uncomplicated hip replacement, right? Whereas managing diabetes or cardiovascular disease is a much greater challenge because you have other conditions that play into that. And determining what is the exact outcome when you have what are called comorbidities is much more difficult. So this is the right path for us, but extremely difficult to do.
Right, exactly. And it's even made more difficult because every human being is unique. So all of these procedures, you think you know what to do as a doctor, but there's so many variables involved.
Exactly.
And we have a diverse population. We're coming to hopefully to the back end of COVID. It seems, the curves are down and everything. And, the healthcare system has obviously been challenged as it hasn't been since 1918 in this country. And that was a different world then. What are the key lessons coming out of COVID?
So I'll just back up for 1 second on the last question, because I want to make sure I'm clear, because again, this is not just doctors benefiting from that. It's the entire system is so completely integrated into this model. I want to make sure I'm very clear.
Yeah, exactly right. I'm sorry. I think I said doctors.
That's okay. So there are lots of lessons from COVID. By the way, one of the ironies of this, and you could have heard me screaming at the television 2 weeks into the pandemic.
I thought that was you. I thought I heard it.
It was me. When I was hearing all these lessons learned 2 weeks into the pandemic, and so it is a really interesting phenomenon. So let me just touch on a few. I mean, we've now had at least a couple of years to really think about what this has shown us. Clearly, it's demonstrated some weaknesses in our system of public health, which, again, one of the good things, it's raised attention to that issue. It's highlighted some real issues around resilience, the resilience of our healthcare system. And a lot of attention, as you know, was paid to medical supplies, hospital beds and ventilators, but also labor shortages. So it's highlighted some issues, again, which raises some interesting issues around globalization and around sort of just-in-time management, which have been with us for decades. And I think this exposed some of the trade-offs that you get. By the way, I'm not convinced that we should do everything at home and that's the solution, but it certainly has raised serious questions about how we approach that. It's exacerbated, I'm going to say exposed and exacerbated inequities in the system. COVID and the deaths, the tragic deaths associated with it were not distributed evenly across populations. And that has really been very clear. My personal view, again, it's highlighted how ideological divide and tribalism affects the way we think about government and the way we think about management in a crisis. And that really, to me, played out when you saw the tension between what should be done at the state level, what should be done by the federal government. Is the government overreaching? Is the state trying to grab too much responsibility? So I think this raises some really powerful and important questions about the role of government. It also, though, again, so those are the sort of things that are sort of on the more negative side. On the positive side, it highlighted our capacity to innovate and to innovate fast. If you had asked me 10 years ago whether or not we could develop a vaccine and bring it to market this quickly, I would have said impossible. There's no way for that to happen. So the development of vaccines, monoclonal antibodies, antivirals, the ability of American industry to step up when asked, actually very quickly, I thought was really impressive and something to be noted. I also think the regulators actually learned something in terms of rethinking their processes in order to move fast. So I think both the public and the private sector, I think, demonstrated some really important things that were innovative and inventive. The other thing I would just highlight, and this is, that I do some teaching, and one of the things I highlight when we talk about this is, what are the changes that came as a result of COVID that were blips in the system, just responses at the moment? What were tipping points, accelerants, and what were sort of longer term changes? And so, like, again, to me, the short term issues were like, ICU beds, responding, getting more ICU beds, or mobilizing non-healthcare players. Those were sort of the momentary responses. But tipping points, something like telemedicine, which existed for many years, and yet once we had to really embrace the use of technology in this way, we did more fully, and there's no real going back. Like that's for real. Systemic changes in terms of understanding the significance of behavioral health. It amplified, again, I think, this very, very important national debate about what's the role of government in a crisis. And so I think there's some positives to take from it too, but lots of lessons learned.
So far, we've talked about the rising cost of healthcare as well as the lessons learned from the pandemic. Next, we'll explore what makes the healthcare system great and what the U.S. can do to get from where we are to even higher levels of greatness. We're going to take a short break and be right back.
As war rages in Ukraine, the Conference Board is closely monitoring the situation and producing timely and relevant content on a daily basis that will help the business community navigate this global geopolitical unrest. What will the impact be on oil prices, food prices, our supply chain, and what about cybersecurity? How will this conflict impact the way your organization does business around the world, and how will you communicate this crisis to customers and employees? We're gathering the very latest content on our website. Just head to conference-board.org and find trusted insights to help you and your team lead with confidence.
Welcome back to CEO Perspectives. I'm your host, Steve Odland, the CEO of the Conference Board, and I'm joined today by George Barrett, the former chairman and CEO of Cardinal Health. So, George, how would you describe the current state of the healthcare system? Where are we in all this development?
I think coming out of the pandemic, we're sort of in this state of, I'd love to say we're at an inflection point. I don't know if I could do that yet with a straight face, but I think we are sort of at this reflection point. We're really starting to look carefully at where we are. I think the pandemic sort of was a wake-up call along many dimensions. And as a result of that, I think we're going to see some real experimentation that I think will be positive. So the use of technology will continue to increase. The ability of regulators to move at speed, I think, is something that we are looking at. We're beginning to look at testing some of the boundaries of where, sort of how far can government push in order to keep costs down or to improve access. So I think there's interesting questions about how willing are we to take big action as a result of the lessons learned. I do think that we're going to see more activity in alternate models of care. I mentioned earlier this idea of value-based care or evidence-based medicine. I think we're going to see an acceleration of that activity. So we will be looking at different payment models, and because I think that's very necessary. I think that we will start to look at behavioral health much more seriously as part of our medical system, as part of our health system. And so I would say I'm feeling fairly certain that that's going to happen. I think that we'll see, and you know this from your work with the conference board, a more active private sector to say, look, we are struggling with healthcare. It's one of the few costs that we seem unable to get our arms around. And so I think that we're going to see businesses be more aggressively pushing some of these changes, some of these alternative models. And I think we'll probably see players that we don't necessarily think of as traditional healthcare players being more active in healthcare. And I think that is partly because of this collision between data science and health. And you could argue data science and the biological sciences, we'll see that in the technology part of the world. But in terms of the consumer experience and the way that we practice medicine, the way we teach medicine, I think we're going to see data science being a much more active part of this equation.
Yeah, really interesting. You know, you can't have a dinner with friends or anything without listening to some stories about the healthcare system. One thing that I keep hearing is, gosh, why can't we have a system that's as good as Canada's? Canada's is the greatest system in the world. And then when you go to places like the Mayo Clinic or cancer clinics and so forth, you run into all these Canadians who are down in the United States who say, I can't get service up in Canada, and so we're all coming to the United States for what, so what country, what is that difference there? And what countries have the best healthcare system?
So you're going to hate my answer because it's going to be one of those weaselly non-answer answers. Where you stand is where you sit, in a sense. What are you measuring? First of all, what are you measuring, and what is precious to you? So, for example, if we are measuring infant mortality, I could send you to Iceland or Finland, where they do it considerably better, much lower rates than we have. If you're talking about coverage, Canada has a great record, as does Australia. If you're talking about the quality of the benefits that you get through your coverage, you'd want to look at France and Germany. And so I think that a lot of this depends on what is precious to you. And when we have these conversations, and I'll come back to Canada in a minute, because it is a very fine system. When we have these conversations, we have a tendency to ignore cultural norms. So when people say, why can't we do what Denmark does? Sometimes when I'm being snarky, my answer is because we're not Danes. Because we have certain cultural norms here in this country. And by the way, when I say norms in this country, you know that they're wildly different from region to region. And so we may treasure something that is not a critical issue in the lives of a Danish person or of a Finn. And so, for example, flexibility and choice, the ability to do what we want is a very American trait. And so when we're told for example, the word mandate immediately raises the hackles for some people. And so I think we have to look at the nature of a country, its history, and its norms when we think about its system. And in some ways, in the US, we're a product of our history, our frontier history. And in fact, our system, which is, you would probably never design a system that comes through the employers, right? But it was a byproduct of legislation during World War II that was trying to prevent competition on salaries for employees. And so people competed through healthcare. And so, so I think it's
tax structures and, right, unintended consequences.
Yep. So I think, so again, Canada, just as an example, has some really wonderful things, and I think they've lots to be proud of in terms of access and coverage. They struggle a little bit with things like wait times, right? Their national system doesn't have a Medicare benefit for drugs. That's left to the provinces. So I think every country's system has some trade-offs. And here's what I'd say about our system. For all of our problems, and they are significant, and I just have to add this, and they are exacerbated by things like food insecurity and housing insecurity and climate issues. These are real issues that are affecting our health. But if you're anywhere in the world and you got really sick, where would you want to be? And I'd probably want to be here. I'd probably want to be here. We are capable of delivering the finest healthcare in the world. Our challenge is that it's inequitable. It's not available to everybody, and it's not consistently delivered. And the way we pay for it, as I said, creates this sort of perverse incentive. So I think there's lots to be proud of here, but we really have some things to fix. And I think there's a lot of work being done to try to address that.
All right, but so if you had the, Harry Potter's magic wand, and you wouldn't build, you said, what the system that we have today, and you can't start over. We're on a moving train. But what would you fix? What would you zap and say, I'd fix this in a nanosecond?
Go to some basics. If we had a spectacularly available primary care system, it would really solve a lot of problems. For many, the primary care system is essentially going into their community hospital. So I think the idea, to me, think about it almost as if we have a general contractor of our care. And if you literally had that person who actually knew you, understood you, they would be able to direct your care much differently than someone who literally is seeing you for 20 minutes and it's sort of being flown through the system. So I think for me, I would attack our primary care system. And part of that, Steve, again, it goes back to incentives, which is, if you're a medical student, are there really good incentives to go out into primary care? There have been attempts to improve that, but we're still not there. The other thing for me, again, personal view, I do believe in universal access. Okay, so that requires some trade-offs. So if I were going to design it personally, I believe in universal access, and I believe that we should have a primary care system that is sound, available, and allows us to have a general contractor of our care. If we could do those things, lots of good things fall in place.
While retaining the most innovative healthcare system in the world, while retaining our R&D progress on pharmaceuticals and everything that you've experienced in your career.
Exactly.
So, you don't want to give up the things that make us, really just differentiated.
You're absolutely right. What we don't do very well in the debates around things like healthcare is talk about trade-offs. Yeah. And it would be nice if we could say, look, you can get this, but it's probably going to have this trade-off. As a human being, that you can accept that idea. I would say in politics, those trade-off discussions are incredibly difficult. And so, moving legislation, particularly when you've got 17% of our economy tied up in this, is extremely difficult.
Well, this has been a great conversation, George. Thank you so much for joining us today.
It's a pleasure to be here.
And thanks to all of you for listening in to CEO Perspectives. Every few weeks, I'll be joined by a prominent thought leader to provide insights on the issues of our time. And we'll cover leading topics in economics, public policy, ESG, human capital, geopolitics, and more. Please share CEO Perspectives with your friends, with your neighbors, with your colleagues, with anybody who will listen to you, because we know that they'll want to listen to our podcast and our webcasts. I'm Steve Odland, and this has been brought to you by the Conference Board.
You've been listening to a podcast from the Conference Board, your source of trusted insights for what's ahead. For the latest insights to help guide your business through this time of geopolitical unrest, we have daily and relevant updates on our website at conference-board.org.